This is the Wellness Masterclass entitled The Wellness, the Overlooked Dependent Variable in Pandemics, Plagues, and Politics with the extraordinary Dr. Richard Carmona. And more about Dr. Carmona in just a few moments. I'm gonna, Wendy, if you would, thank you so much. I'm Nancy Davis, Chief Creative Officer and Executive Director of both the Global Wellness Summit and Global Wellness Institute, and your host for today's call. I want to thank Karen Ballou, founder and CEO of Immunocologie, our generous sponsor for this Wellness Masterclass. This is the first year we are having these calls sponsored, and as long as we have generous supporters like Karen, you will all continue to enjoy these events without cost. So much gratitude, and I will be asking Karen to comment a bit later on this call. I'm just getting my Zoom back, which seems to have disappeared somewhere, so bear with me for 1 second. Before introducing Dr. Carmona, I want to introduce Susie Ellis, Chair and CEO of both the Global Wellness Summit and Global Wellness Institute. Susie is the guiding light, not just of our organizations, but also the industry. And her optimism and vision will take us all forward into the future. Susie?
I simply want to say good morning, good afternoon, good evening. And I'm just so delighted that Dr. Carmona has become a good friend, is with us today, and just want you to have as much time as possible. So back to you, Nancy.
Thank you, Susie. My Zoom has disappeared. Okay, but you can see me. That's the most important thing. Before I just want to give you a quick refresher on Zoom. Most people now are really very adept at this. So I'm going to make this very short. I just want to remind you that Wendy has muted everyone to eliminate background noise. You can view this call in a gallery view or a speaker view, and you can make that choice at the top right of your Zoom window. Please use the chat function as you are to say hello, tell us where you're from, and post a question. We'll try to get to some of your questions, but rest assured that Dr. Carmona will be sent the questions and his answers will be part of the follow-up we send out. So thanks for your cooperation. Now it's my honor to introduce Dr. Richard Carmona, 17th U.S. Surgeon General, Chief of Health Innovation for Canyon Ranch, a distinguished member of the Board of Directors of the Global Wellness Institute, and literally hundreds of other resume items that would take all day to acknowledge. Rich is a dear friend and colleague, and this is his third Wellness Masterclass appearance. He was tremendously helpful to us all in 2020 as we navigated the barrage of information about the pandemic. He offered sane, sage advice on everything from health and safety precautions to mental health issues. Rich served as medical advisor to the 2020 Global Wellness Summit, and I'm proud to say joined us on site at the Breakers Palm Beach last November. It was a defining moment for the summit, as well as the event industry, whose members keep calling to find out how we pulled it off. When they asked me what we did first, I say we called Dr. Richard Carmona. I just want to take a moment to acknowledge something about Rich that I think is more important today than ever before. When Rich went through the confirmation process to become Surgeon General, he described himself as, quote, an agent of change, willing to question the status quo, but that he always treated patients, staff, and coworkers with respect. He was, by the way, unanimously confirmed by the US Senate. Knowing him, which is one of the great privileges of my life, is to see up close this agent of change. At a time when we find the world polarized and politicized, Rich is a voice of reason and resolve. It is particularly poignant that Rich should be with us today, as another agent of change takes her rightful place as the first woman and first woman of color to be sworn in as Vice President of the United States. Yay, Kamala Harris, and yay, Rich Carmona, a man who broke barriers, challenged the status quo, has never stopped fighting for what is right and good in this crazy world, and doing it with grace and grit. He has been instrumental in guiding the work of both the Global Wellness Summit and Global Wellness Institute. And he's here today to help us understand how wellness can make a huge difference in the world, especially now. He calls me Sergeant Major, and other than Gammy, it's my favorite nickname. Richard Carmona.
Good morning, Nancy, and good morning to the Global Wellness family. All of you out there, I understand hundreds of you in 70 or 80 countries. And to me, it is, it's surreal because what we'll talk about today is something that we absolutely all need. But before I start on my remarks, I just want to reflect on, a decade and a half or so of knowing Susie and remembering the dark days where we started out in trying to forge a movement, not only nationally, but globally, to be able to effect the necessary changes to pursue optimal health and wellness in a nation and a world that was struggling and drowning in really self-imposed disease. And so here we are a decade and a half later, and really a testament to Susie, as well as Nancy and the GWI and the GWS team, is that we do have a family of global leaders that are coming together every single day to really get through all the chatter and clutter and help us pursue those things that can optimize our health, our wellness, which I'll speak about a little bit today. And so when I was asked by Nancy and Susie to take on another one of these classes, and I thought, how can I put something together that intersects the importance of wellness in an unwell world with all of the tumultuous things that have gone on in the last year and in our country for the last 4 years, where you feel like you had to get up every morning with a seatbelt on and a safety harness and maybe a helmet, because there was so much tumultuous things going on. And so I came up with the idea of this overlooked dependent variable, because as we look at wellness, that is the optimal alignment of mind, body, and spirit. And we look at pandemics, plagues, and politics. It is the antidote to treatment. It is just what the doctor ordered. If you could write a prescription, okay, I would write a prescription for wellness, and I could probably make most of the world better if they were able to abide by what was in that prescription. So as I thought through the different areas I would like to speak about this morning, and being that the time is limited, and also that it's necessary that we leave enough time for questions, and based on what I see popping in chat, it's going to take a while, and I probably will have a lot of homework once this is over, as Nancy said, to get to all of them, but I will do my best to do so. I broke it into several areas, and those areas were, first, an unwell world a year ago faces and poorly manages the first pandemic in modern times, in 102 years to be exact, from the last pandemic in 1918. And moving on then to the global plague of pre-existing preventable disease and economic burden, which exacerbates that pandemic. And then I think, well, what about the remedy? What happens next? And that's where I thought, well, we have to go back to our future. Wellness then and now. What do we know from the past, from our ancestors, from other civilizations? And the irony is, as we look to optimize health and wellness and align mind, body, and spirit, more and more we reach back to the past and look at what our ancestors did. Whether it is eating farm to table or mental health issues, a lot of the answers are in our past. And it's quite amazing to me that our very survival is understanding some of these basic issues. And the wellness then and now, an immunity shield, an antidote, a treatment, connecting the dots of mind, body, and spirit. And what's amazing to me as the world has advanced so fast, in the last 100 years and industrial revolutions and where we are today in the digital world and connectivity. Yet the very elements that we need are ones that have been there all along, and we kind of ignored them. And unfortunately, I think that we at Global Wellness, of course, know that these things are very important and essential to us. And then I move on then to the invisible wounds of a pandemic: uncertainty, mental health challenges, conspiracy theorists, anti-vaccinators, all potentiating fear and uncertainty and anxiety in the society. Not only ours in the United States, globally we see it. And so putting those all together, I'll do a pretty quick overview of where I see where we've come from, what's happened, the burden that we have, and so on. And then at that point, hopefully be able to take some questions from you. So first starting out, the issue of an unwell world faces this pandemic. We had infrastructure in place. In most of the developed world, there are emergency plans. In the United States, it's called a National Response Framework, which I and many of my colleagues had an opportunity and a privilege to put together many years ago, after 9/11, during Katrina, in order that we are able to better face any and all threats or hazards, what's called all hazards, that our nation may face. And the reason we chose that term, all hazards, is because you never, whether it is a biologic event, whether it is an adverse health event, whether it is a terrorist event or an active shooter, the same resources respond. So as we looked at framing these issues, we use the term all hazards to mean any and all things we know today that can threaten not only our nation or the world, because we shared this information. When I was Surgeon General, I traveled the world and met with leaders from all over the world to see what they were doing, to get best practices, to crowdsource information and share, because we are a better, healthier, more stable world when we share our information. And so we recognize here, for instance, with COVID, it didn't start in the United States, it starts someplace else. And many of the threats that we face start someplace else. But if we can help the rest of the world be better prepared, it also is good for us, because we can basically have a sense of what's happening and maybe coming to us. And many of these problems that you've all heard and read about in the last number of years, SARS, MERS, COVID, avian flu, they start someplace else. And that's okay, that's the way it is. Where the animal kingdom and the human kingdoms come together and there's exchanges of these germs, pathogens, bacteria, viruses, etc. These things can happen, but we're better prepared when we come together, when we hold hands, when we join arms, when we share information, because we have much more in common than we do as it relates to those things that others use to separate us. So when I look at the disease and economic burden in the world, it's a very complex issue, but using the United States as an example, spending 19% of our gross domestic product on what we call healthcare. It's really not healthcare, it's sick care. This is something Susie seized on many years ago in our value proposition for driving the growth and the excellence within the Global Wellness Institute and Summit. That 3/4 of what we spend our money on, we spend on to undo chronic diseases that we cause by the poor behaviors that we exhibit. Being sedentary, eating the wrong foods, living in stressful environments, not being kind and caring, all of those variables really come under that umbrella of what I call the unwell world, but the wellness is what cures them. And so when this COVID pandemic hit about a year ago, yes, we've been in this about a year now. And the deaths are piling up, the morbidity, mortality, the economic catastrophe, all of them. And yet it didn't have to be this way, because as the world engaged, we became a world divided by partisan politics, by conspiracy theorists, by all kinds of crazy ideas that had no merit whatsoever, but served the purpose of an individual or individuals or a political party to be able to keep people divided. And that was very dangerous, and it continues to be dangerous today. Although this is a day of celebration in our country, where hopefully we're on the first day to regaining some peace and tranquility and having some rational discussions about what is important in our society and as well as the world, and where the United States can once again take its earned place in the past for being a leader, for helping others, for reaching out, for having a heart, for having a conscience, for understanding that we are a very small part, 340 million people in a world of 7.5 billion, where people struggle, where millions die needlessly because of lack of clean water, lack of sanitation, lack of wellness opportunities. And yet we do have that opportunity, especially working with our allies, to make it a better world. So when this occurred, we had that disease and economic burden. COVID hits. We're further divided by the hyperpartisanship and the challenges that we spoke of. And so when we look at that, what's interesting, for many years, there's been a paper that came out a couple of decades ago from the World Health Organization about the social determinants of health. And basically it outlines how inextricably we are tied to our environments, where we work, how we recreate, our education level, all of those things. And they are inextricably tied to our health outcomes. And in fact, in the United States, it wasn't uncommon for many years, and even in some areas still today, where a zip code could define how you would do in life. And so all of those things are extraordinarily important. So as we move through from the idea of an unwell world facing this pandemic, and as the pandemic hit, it couldn't have happened at a worse time, politically, health-wise, science-wise, the divisiveness that was there that separated us. And you saw it play out in our country as rest of the world, where there was no overall guidance. There was much more talk about unusual conspiracy theorists, anti-vaccinators, and that divided people. So people didn't make the best decisions, where the mask became a political statement rather than a health statement. So as we look at all of that happened, a lot of it was needless. It was driven by things that kept us divided, that didn't allow us to all focus as one on what the threat was before us and what are the appropriate remedies to deal with that threat. And then when we look at the economic burden at that time, as I said, we were already, most developed nations, struggling with increasing debt, trying to keep up with the disease and economic burden in a non-COVID world. And yet most of that was preventable. And hence that value proposition for global wellness, our summits, our institute, was about optimizing health and wellness, aligning mind, body, and spirit, and being the best persons that we can be, the best communities we can be. And one of the things that popped up in COVID early on was that we started to see that people of color, African-American, Hispanics, had a higher incidence of morbidity and mortality from COVID. And so it go back then to the World Health Organization report on the health disparities and the social determinants of health. And what you see is that these populations who struggle every day, who don't have access to healthcare regularly, who don't have access to some of the best science emerging, who struggle on a day to day to just make a living and find healthcare and find food, they are disproportionately affected. And as they are disproportionately affected, there's a whole host of things that pop up in our discussions. You know, the humanistic approach to this, the health approach, the economic approach, because it's costly to allow these things to occur. Once again, that absence of wellness in an unwell society where it's already been defined that certain categories of people, based mostly on their ethnicity, do worse when bad things happen. And on a good day, do worse as well. So this global plague of the pre-existing preventable disease and economic burden exacerbating the pandemic is something that is very important not to forget, because as we memorialize the lessons learned from this particular pandemic, first in over a century, we must remember that there are vulnerable populations that don't have the wherewithal, don't have the knowledge, don't have the money, don't have the connectivity to be able to survive well in these adverse times. In fact, when we built our national response framework many years ago, we started to identify some of these vulnerable populations. And in the United States, one population that we did identify as being unusually vulnerable to these changes were the original Americans, the American Indians living on reservations in our country. And yet, a century and a half ago, they were among the healthiest people in the world. And today, they are among the least healthy, where we have rampant obesity, dropout rates, domestic violence, suicide rates, child suicide rates. All of these metrics that we use as health indicators are in the wrong place because they have been marginalized. And so we did a carve out there so that when and if there was a national emergency, people would recognize that we need to have disproportionate resources available for these populations because they can't do it on their own. And so when I look at the American Indians and I think about it, what was interesting to me, and ironically, what is so funny right here, is that when we talk about going back to our future, wellness then and now, in our country, if you look at the American Indian, and in 1900 in the United States, the life expectancy was about 48 years old. Native Americans lived longer than that. And when you start to look and say, well, why? How is that? Well, think about their culture. It was largely a bartering culture. They grew their own food. They stayed physically active throughout the lifespan. In their families, their elders actually became more revered as they aged. So when you start looking at all of the elements of these older societies, and I'm just using the American Indian as one example, because my friend Dan,
I'm sorry, Rich, I do want to get to some future things. And so if you could wrap
yes.
up that would be great.
Yes. And so when we get to the issue of looking at these past societies, you see there's a lot of information there that's going to help us understand where we're going. And going back to the future really is understanding that as we look at farmers markets today, as we look at eating farm to table, as we look at staying physically active throughout a lifespan, as we look at anti-loneliness, loneliness being a potentiator of loss of cognitive ability, all of those things are extraordinarily important. And yet we're reaching back to the past to bring them forward because it really was what made us very healthy back then. And we're understanding today that that's important. So in addition, we have the invisible wounds of the pandemic: uncertainty, mental health challenges, conspiracy theorists, anti-vaccinators, all potentiating fear, uncertainty, and anxiety. What does that do? It layers upon all the physical challenges, mental health challenges, depression, suicide rates going up, divorce rates, domestic violence, all of those things, creating uncertainty because people don't know if it affects me. What happens? My loved ones could be affected. If they die, I can't go to work. I'm in danger of losing my home, my car, and on and on and on. All of those things weigh very heavily on us. So as I wrap this up quickly and then go to your questions, I'm reminded of what Pogo said. You know, we have met the enemy, and the enemy is us, a nation and a world that is divided. Exactly what we don't need in a pandemic. We're in a pandemic. What we absolutely need is to become united, because whether you look at our DNA or whether you look at us socially, we have much more in common than we have that divides us. Yet there are those that will leverage that divisiveness for their own benefit. So what we need to do, is come together as one, in a world that has a common threat. Reject malignant hyperpartisanship, rhetoric, conspiracy theories, and self-motivated, self-serving behaviors. And to paraphrase Gandhi, we need to be the change that you want to see in the world. Use the best science and pursue optimizing and aligning mind, body, and spirit, what Global Wellness Institute and Summit does best. The global wellness family is what an unwell world now desperately needs. For we understand we have far more in common as humans than what others use to divide us. Be kind, be caring, be smart, so we can all emerge from this pandemic together. Create the new normal where we can once again touch, hug, high five, kiss, nurture our souls. And as we, the global wellness family, change the world, it will become a better world because we have the wellness tools necessary to be able to immunize an unwell world, not only from COVID, but from all of the challenges of daily life. So Nancy, I'll stop with that.
Thank you, Rich. Thank you so much. It was, great to have you bring us kind of up to date. I want to spend some time on what the future looks like, given where we've come from and what's been happening. What one of the things that COVID did that you have referenced, that we've all referenced, is it has really shone a light on wellness and on the opportunities and the impact wellness can have.
Yes.
Your dependent variable, what we can do. And you are speaking to global wellness leaders, not mostly US, but mostly all over the world, who really, play a part in this change that we all very much want to see. Politics aside, I'd like to stay more in the realm of, science and evidence and wellness for a minute, and talk about, what we can do as a group, as this family, as global wellness, to really have impact that is lasting beyond where we are right now in with the pandemic.
Mm-hmm. Nancy, it's a great point you make, and thank you. Again, I brought up the politics because I think I would be remiss to ignore it, since it is a potentiating factor in what happened, and not only in our country, but globally, that was divisive. But more importantly, to your point, how do we come together and how do we create that world of the future? And I think it really is what we've done within the Global Wellness Institute, driving the best data, knowledge, science, and putting it out there and sharing it for the rest of the world. The mere fact that we have hundreds and hundreds of global leaders on this call right now bespeaks to the importance of what we're doing, because they recognize they are the opinion leaders in their communities. They are the agents of change. And we come together, we share our information annually and intermittently with our institute, with our summits, and then in between all the calls we make and all of the little ad hoc things we do. And think about how far we've come in this decade and a half of this history of our global wellness team. And that's what we need. We need to go beyond this partisan rhetoric and challenge, put that aside, celebrate what unites us as humans, okay? Because we are far more alike than we are apart. All of us want to have health. All of us want to grow our children in a safe environment and have opportunities and so on. And so that's what we focus on, and that's what Global Wellness focus on. So we need to continue to crowdsource information, best practices from the macro, which is where we started, eat healthy, exercise, and so on. And today we're talking about epigenetic effects in your environment, how your genes are expressed positively or negatively based on the decisions that you make every day about food, about relationships. Simple things, giving people a hug, being kind, looking out beyond your own needs to your community. What can you do to make the community better? And our community is global, which is wonderful. So I think it's all of those things, Nancy, that I'm very excited about and so grateful that Susie and you and our team have continued to grow and really be the meeting place, the center of aggregation of best practices for the whole world as it relates to aligning mind, body, and spirit.
Thank you, Rich, and thank you for those kind words. You sit in a particularly interesting place as a medical doctor, and actually a nurse as well, but a medical doctor, a surgeon general, and a wellness champion. I mean, always. So when you're on calls with the CDC and when you're, helping to drive the response on a global scale to this pandemic or whatever, God forbid, comes next, how do you influence that conversation with bringing wellness into the conversation? Do you, how receptive do you find the medical community and those who are in a position to really guide this, this process?
Thank you, Nancy. It's a great question. And first, the easy way for wellness now is to introduce it just as a prevention tool, because as we recognize the disease and economic burden that's going up, and we have a debt in our country that's terrible and potentiated by COVID. But as we look around the world, it's the same thing. What are we spending our money on? We're spending our money on things that can largely be prevented. Well, if we're running a business, we will eliminate those things clearly, or you couldn't stay in business. Well, our business is government, okay? And we have to figure out a way to get the government to be better aligned around these issues, because often they become partisanized. And really, that is the big challenge. we are the ones that, independent of political affiliations or where you live in the world, the answers are always based on the best science. And they're simple things. So, stay physically active, eat, food to table, farm to table as much as you can, be kind, be caring, be a part of your community, spread the word, and slowly, incrementally, we're able to make changes. Now, CDC is easy because, or even NIH or some of our organizations, because these are people that are well aligned with what we do in global health and global wellness. They understand.
Sandra, un momentico, espéreme que yo termino ya.
Oh, sorry.
Somebody accidentally unmuted. That's okay, Rich. Keep going.
No problem. So they understand the importance of what we are doing. And in fact, in a lot of ways, we've been able to be even more successful than some of our colleagues that are restricted within a government agency, not only here, but around the world. Yeah. Because, depending on politics and people. But if we can continue to be the beacon of hope as global wellness, because we can speak truth to power, we can aggregate the best ideas. And often some of these ideas come from elsewhere. Think about this. For how many years in our own medical schools and nursing schools, when I was a younger person learning, the Eastern practices, what's called complementary or alternative, were dismissed because there was a sense that, what I would call the arrogance of Western medicine, that we knew it all. And now we're actually studying this at the NIH and finding out, well, many of these practices do have merit. It's not just a placebo effect, that mindfulness, that meditation. And you look at how that spread. I mean, you have professional teams practicing this now. And so athletes, So more and more, we're breaking those barriers and really looking at, looking at Ayurvedic practices, looking at Chinese medicine, looking at herbal medicine, looking at every single aspect of optimizing health and wellness and putting it out there. And the beauty of global wellness is we have a global distribution network for content that can really change and drive policy in anybody's community.
Rich, there are lots of questions, and you will be sent all of these, and some of them are very sort of medically driven, and some are wellness, and there's a lot of resonance in what you're saying, with people feeling that governments really need to get involved, and we really need to be lobbying, and we need to do a lot more in terms of moving that particular needle. I think I would be remiss if I didn't ask you about the rollout, the vaccine, what you see. Is there hope? Can we be hopeful about what is happening with that in this world, because it's being rolled out all over the world? And I wonder if you could just comment on that. Some people have asked about that.
Yeah, oh, great. I'm happy to. The rollout, as you know, has been quite bumpy. If we look at the United States, where we had hoped for at a federal level guidance as it relates to a uniform approach, we didn't get that. We got divisive rhetoric, and so each
maybe
state.
Just if you could focus on the efficacy of the vaccine and whether you think that's going to be, do the trick, because
well, you got to get it to people first. I'm getting there. So first you have to get the vaccine to people. There's a delay in getting the vaccine to people because when we look at what's happened, each state is on its own, and within each state there's cities, and sometimes they even compete with one another as you follow the news. But once we get it to the person, we know that the first two that have come out, the Pfizer and the Moderna, 95% effective, very few side effects. So everybody should get a vaccine that can. Now, if you have a unique medical problem, your physician suggests you don't for that reason, that's fine. But for the average person, most people, you should get the vaccine. The importance of that is it accelerates what we call herd immunity. Herd immunity is the quest that we get everybody to have immunity to this COVID virus. Now, you can do it naturally. That means that you wait till everybody gets sick. A lot of people die, a lot of complications, a lot of cost. Or you can accelerate herd immunity by everybody getting vaccinated. And when everybody getting vaccinated, it stops the transmissibility of disease a lot earlier. So I encourage everybody to get the vaccines. There are others in the pipeline now coming out. But once they have been validated by our FDA or the equivalent organizations around the world, I would strongly suggest that everybody get vaccinated to accelerate herd immunity, stop transmissibility, and get us out of this problem so we can move to inventing the new normal as we move forward.
Rich, thank you very much. And I know not everyone agrees on the vaccinating question, but I think it's really important to hear from someone like you about it. I want to just ask Karen Ballou to comment here. Karen is not only the sponsor of this call, she's a real thought leader about science and wellness coming together. She was part of a main stage panel at the summit about it. And her story in building her company really had a lot to do with rebuilding her own immunity about cancer after a battle with cancer. And I just want, Karen, if you could just comment quickly on, what you feel is important going forward for wellness in this new normal, this new world of ours.
Yes, thank you, Nancy, and to everyone. And Dr. Carmona, this is phenomenal because I think with everything that you've said, one of the key points I have taken away from this is the importance of the past and what we've had in the past that is now today in the future. Yes. And so that's really where my story begins. And that is, having gone through cancer and yet having spent my whole career in the cosmetic industry, I had to stop and say, what's going on here? And so the development of immunocologie being the study of the skin's immunity. Yes. And it is so very important. And I have been studying this not only since I was sick, but I had been studying it before that. And so I just come together with all of you here at Global Wellness that this is such an important subject. And, the warmth and being able to come together, but also we're putting, somewhere around 55 chemicals on our skin every day. That is affecting our immune system as well. Yes. So I just, want to say that I could talk forever about this subject with you and with everyone, but I just want to say that this was my journey and I know how important it is to the immune system to be healthy, even with what we put on our skin and how we put it on our skin. So I am so happy to be here and I'm happy that immunocologie as what I call the study of the skin's immunity. And if anyone has any questions on that, I would be happy to answer those questions.
Oh, if I may just
Karen,
comment.
thank you.
Nancy, can I just make a quick
please,
comment?
Yes,
she
please.
brings up, thank you for these wonderful comments. She brings up something very important. We've all been talking in the last number of years about the microbiome. That is all of the various bacteria, viruses that are inhabiting our ecosystem from our mouth down to the anus. The skin has its own microbiome, and exactly. That's what you're thinking. And in fact, you're spot on that we kind of ignored it for so long. So it's great that you bring it to our attention, that people realize that the skin is an immune organ as well.
And just to wrap on that, I just want to say that's why with the skin's microbiome, it is so very important how we balance the skin. Right. And it's really maybe simple, but the more chemicals that we add to that skin's microbiome, the more imbalanced it becomes, and the more imbalanced the body becomes. So that's where my journey, and with my skincare, it's really about wellness. I look at it as more about wellness, and you'll look beautiful. But the point is that it is about wellness first.
Yes.
Thank you, Karen. Great. Thank you so much. Thank you for all you do for us. Rich, I want to ask you about gathering in person. We did a very controversial thing this past November, and it was actually very successful in great part thanks to your guidance and the team we put together. But the mental health crisis, the isolation that is a result of what has happened in the world, and what the wellness world can do about that. Can you talk a little bit about that? I know mental health issues are hugely important in your daily conversations about this pandemic, and what we can do as a sort of antidote to that.
Well, Nancy, you're spot on. We get so wrapped up in focusing on the virus and vaccines and antivirals and steroids and everything. And yet, as we go along, that's why I said it's almost a year now, and we've been isolated. We're humans. We want to hug you. We want to high five. You want to kiss your friend, your girlfriend, your boyfriend, whatever, and without that interaction, there are not only immunologic consequences, there are major mental health consequences that come from that. So again, going back to how we are and why you and Susie really bravely said, let's do this because we need to come together. What we need to achieve is balance. We just can't tell everybody stay home till it goes away, because the unanticipated disease and economic burden, mental health, and then everything that comes from bad mental health would be catastrophic. So how can we, for instance, continue to educate our kindergarteners and first and second graders? Okay, they desperately need that interaction. They're learning how to view social interaction, how to speak to people, and so on. And then you go right up to seniors, and we find out, what do we, in our country, they get parked someplace because they're slowing down, they can't keep up with the kids. And so now we lock them in these places, and they cannot interact with others. And it was heartbreaking to see people dying with family at a window, standing in an alleyway, looking into a hospital or a nursing home as grandma or grandpa died. We must figure out a way to continue to express our humanity as much as possible safely. And really, that's what we did at this conference, because I want to point out the reason it works so well. Who I lovingly called a Sergeant Major, Nancy, was out there every day checking bracelets. If you didn't have your bracelet on that you were tested, you could not get in the room. When we were sitting having dinner, we were socially spaced. I mean, she made sure that the best public health practices were practiced. Paul Leone at the Breakers made sure all of his staff continued to do. So the team came together, and we were able to demonstrate that we could safely come together and feel good about that, but still not transmit disease. And that was the importance of that thing. And as you said, I've gotten a lot of calls as well to say, how did you do it? Well, we did it because we all put together a fantastic team that worked together for a common cause.
Thank you, Rich. It was, and it was quite an event. And I think I always felt very much that, if not us, then who? I mean, if the wellness industry wasn't going to try to do this right,
Yes.
then, we could really be a model for going forward. Rich, there are comments in the chat, which you will be given. And there are people who are not necessarily embracing of vaccines, but are not by any means fear mongers or, enemies of wellness. And there's definitely, a component part of our world that does not embrace that.
Yes.
And wonder if you would like to just comment on that.
Yeah, let me make an additional comment. First and foremost, I recognize that the people that I am most critical of are those that use that divisiveness for their own reasons. There are legitimate reasons why people don't want to get vaccinated. Sometimes religion would prevent you from that. And we accept that, okay? Sometimes you have a medical condition that would preempt you from doing that. But what I find that a lot of the people that don't is the uncertainty, because of all of the bad information that's been out there on various social media platforms and such. Well, how do I know it's good? Is the government trying to fool us? I've had people tell me that this whole COVID was a conspiracy theory, between the China, to be quite honest with you, the Chinese and a political party. It'd been things that had no basis whatsoever. But there are people that gravitate and listen to that. So I'm just suggesting, if you have a doubt, talk to your healthcare professional. These vaccines have been tested. The FDA requires that you have an efficacious vaccine and one that does no harm. The testing was accelerated because we had a pandemic. I got mine 2 weeks ago, okay? I had my children get them. I would not do that if I felt that it was going to harm anybody. And so I would just encourage everybody, talk to your physician, nurse, practitioner, PA, whoever you get your healthcare from, and look at the scientific facts. Try and leave the bias at the door, whatever that bias may be. But I do recognize that there's still people on an everyday basis. We have people that don't get a flu vaccine because they feel they don't want to, or it's against religious belief or personal relief. But the more people that get vaccinated, the quicker we're able to achieve herd immunity and get rid of this disease, which is why I'm such a strong proponent of vaccination.
Thank you, Rich, and thank you for explaining that. There have been a number of people commenting on the UN, on the World Health Organization, on being able to motivate those large bureaucratic bodies to do more. in the spirit of wellness and healthcare coming together. Can you comment at all? Do you work with those organizations in what way? And is there a way that you think we can take this forward?
Yes, I mean, I've worked over the years with World Health Organization, Pan American Health Organization, in the United States, the American Public Health, there's a number of these large organizations. The ones that are independent are a little bit more nimble. The ones that are more tied to governments, it's a little slower because of the diplomatic process that has to take place. But I would say it's been my experience, they are all good people whose self-interest is put aside. The years I was Surgeon General working with the WHO and the Pan American Health Organization, both parts of the United Nations, there's legitimate differences of opinion as to how to strategically move forward on any issue. But I never saw people that were subverting the truth, that were trying to do something that wasn't in the best interest. Yet they were encumbered in a complex bureaucracy trying to move something through, which is the great value we have in global wellness. We don't have those encumbrances. You bring people together with great ideas to innovate, to disrupt the marketplace in a positive way. So really, I used to jokingly say, when I was Surgeon General, we don't look to the federal government for innovation, okay? We look to the community, like the global wellness people, for innovation and disruption. The government can support it, but often the nimbleness of the private sector supersedes that of the government being able to be nimble.
Yes, I don't think you would have any argument on the government not being a place for agility and innovation, at least not lately, but we all have hope for the future. Rich, what's your hope for the future? What do you think 2021 is going to be like? Now we have survived 2020. The wellness world is certainly front and center in a lot of ways in people's mind. There has been tremendous innovation in technology, in real estate, in wellness communities, a lot of aspects, a lot of sectors of the industry. What do you see for 2021?
I see hope. And hope is not a strategy, but I see that we've all suffered the pains of the last year and the disease, the economic burden, a world that's been threatened by the same threat, a virus, an invisible threat that kills. And yet we have all of these disparate ways it's been handled, sometimes poorly, sometimes reasonably well. But as I alluded to and stated in my remarks, we need to come together as humanity, not as Chinese and Hispanics and Blacks or Africans or Muslims or Jews, as humanity. Celebrate the diversity. Our nation is as great as it is because of its diversity, as are many other nations, okay? We celebrate that. Come together. Let's leave any of those biases at the door and focus on the proximate cause of what challenges us today. To do that, we have to share information. We have to agree on a path forward. And I think that we're taking those first steps now. And I hope that we will aggressively pursue this. And I know, rather than hope, that global wellness will continue to be the aggregator, the preferred aggregator of global thought leaders to solve many of these problems. It's not like we don't have the answers. We just have to align around them and then be able to move forward and appreciate the past, as was pointed out already, and bring that forward. Farm to table, anti-loneliness, all of these simple things that in aggregate will help us to be a healthier world.
It does really feel like Back to the Future, doesn't it?
Yes.
I mean,
yes.
so many things that happened really brought to the fore important central foundational elements of of family and home and school and all of those things that were important on a global scale, for sure. I want to mention the wellness. Oh, Susie, do you have a question?
I was just I think you and I are on the same page
about Wellness Moonshot?
Moonshot, yes.
Yes, that's exactly what I was going to say.
And I have in my office a sample. I'll go get it.
Okay, wonderful. I wanted to mention that. So Rich, along with a number of leaders in health and wellness, helped us launch the Wellness Moonshot, A World Free of Preventable Disease. Out of the Institute. Susie is holding up this year the brand new 2021 calendar that Jessica Jesse designed. We discussed it on last week's masterclass. And it's an incredible vehicle for change, I think. And I think that is what it was designed to do. Every month we offer information, tools, inspiration to get on the prevention bandwagon with us and to really take this forward on a global scale. It doesn't, cost anything to do those things. These are all, it's a very democratic approach to prevention and wellness. And I think that, it's poised and ready now for, I'm going to say world domination, but, I think it can get bigger and bigger and bigger. And this is the time. It feels like a real moment in time for this. Susie, I'd like you to comment before we ask Rich to comment on that.
We've done the Wellness Moonshot, a world free of preventable disease, was launched in 2017 with Rich Carmona and a lot of other medical and wellness people on a stage. And so we've learned along the way how this is resonating. And this is what I have learned and what I'm excited about. This is just a tool. It's a tool, a way to talk about different educational parts of wellness. All of you on the call do different things, but it's all in helping people have better lives. And but this is a tool. And here's what I think is fun about it, because it is a little fun, for kids and for teens and for all of us. It's not always fun to sit around and talk about prevention and, pandemics and so on. But here's what we've done. Once a month, we have a celebration called the Full Moon Celebration. And on that day, and the full moon is the same day all over the world, which I did not know, but I know now. And on that day, we have a celebration, and we just encourage everyone to sort of get involved, create a celebration. And what I've done is every time I look at the moon, I am aware, oh, it's a half moon, it's a crescent moon, oh, it's a full moon. If it's a full moon, that's the day I think about prevention and the Wellness Moonshot and the fact that we want to get rid of preventable disease, lifestyle diseases. So it's a tool, and I just would love more people to get involved with it. Nancy, we've spoken with a gentleman from China who's adopting this for China, and he's also using some different words. There's one word a month that, we come together and we give out education and so on about it. But they are lining this up with their solar calendar in China, and which is a great idea. And so we've made this customizable also. But Rich, why don't you talk a little bit more about it? Because I know you have it hanging in your office.
Yes.
Maybe not the new one yet, because they just were just mailed. But yeah, tell us about your involvement with it.
Well, first and foremost, I have to give Susie credit, because she bravely jumped on this when we were doing some planning a few years back for one of the conferences. And Susie said, Richard, we need to do something innovative and disruptive. We need to get the world behind everything that we've been talking about with prevention. And we said, well, after a couple of days of these things, and I think that we finally agreed on it the night before the conference. And Susie said, okay, let's go with this. And I said, let's give the grand challenge, a world free of preventable disease. And then Susie and Nancy put a team together. And what you see there is the culmination of a lot of people crowdsourcing information. Jessica with her great artistry, putting things together, because we said, okay, what do we do to symbolize this? And the discussion then moved on. Well, let's give a framework to people to do something, because right now you just say, okay, be healthy. Well, how do I do that? So now every month you can look at that calendar and say, I'm going to focus this month on this. Whether it's your family, whether it's your business, whether it's your city, wherever you come from. And so that's kind of more or less the strategic plan for the year as it relates to activities that will optimize your wellness. And that's what the calendar is. And every year we tweak that a little bit. And Jessica has been great in coming out with great artistry that inspires people, because it looks nice in the offices and so on. So that's the history of it. And how many years are we now, Susie, for that?
This is the third year.
Okay.
Yeah, and Jessica decided to go bold with color blocking. She's just so creative. So it's very attention getting, and just to have fun with it, and people can do different things with it. Yeah. But it unites us all behind the idea of being proactive. Yes. The healthcare industry is doing their part. They're doing a lot of things. But they're cash strapped. It's expensive, and there's not that many of them. But there's a lot of us and we can do our part
Exactly.
and encourage other people to do their part with exercise, nutrition, healthy sleep, all the things that we talk about.
And Susie, I think another thing that shows is the power of aggregated knowledge through global wellness, because no one of us takes credit for the whole thing. It was lots of ideas that kept, and every year it gets better because
Right.
we get the best ideas from all of our members around the world.
Exactly.
Yeah, I want to say that collaboration has been key to, I think, the success of both organizations all along, and all of you on these calls are a huge part of that. It's very important, this engagement, this connection, especially at this time, and the way that we really do move the needle, move things forward by talking to each other, sharing these ideas, and then taking action, which, you know, is part of what the Moonshot does. It's a vehicle for action, and it's a very, very important part of what we're doing. I want to use the last 2 minutes, Rich, to do a little this new thing I'm doing now on the master class this year, which is to take a page from the actor inside the actor's studio and give you a lightning round of questions with like basically one-word answers. Okay, so are you ready?
Yes, ma'am.
Okay. What is your favorite wellness word?
Exercise.
What is your least favorite wellness word?
Politics.
What is your favorite word in the healthcare arena?
Togetherness.
What is your least favorite word in the healthcare arena?
Let's see, business.
What would you do if you didn't have all the current jobs you do have? What job would you have?
Wellness director for the world.
I think you do have that job. Rich, what is your superpower?
Being part of a wonderful team in global wellness with the extensive network that it has.
Okay, and if heaven exists, what would you like to hear God say when you arrive at the pearly gates?
Thank you.
And thank you. We thank you. I'm going to ask everybody to unmute themselves. It's not something we can do. And let's give Rich Carmona our gratitude and some global love.
Thank you, Rich.
Obrigada.
Thank you.
Great job.
Gracias.
Yay!
Hooray.
Thanks a bunch.
Dr. Amazing. Thank you so much.
Thank you.
Thank you. Great job.
I loved it.
This
Thank